Okay, wonderful. So I see people from, let's see, we've got, oh, I just lost a bunch here. We've got Philip from the OIC, it's which the one that popped up first. Hi, Philip. CISC, good to see you, Rebecca. And Celeste from Edmonds, wonderful. Jean from Island Senior Services, good to see you. Mount Vernon Regional Council. Angel from CISC, good to see you as well. Mike from AltQ in Spokane, and Monica and Kathy, a number of folks. Kelly from Senior Services in South Sound, San Juan, all kinds of folks. Wonderful. Thank you guys so much for joining today. This is going to be fun. Can everybody see my slide deck? Okay, can you see the slide and it's not in presenter view? Just making sure. A thumbs up. And I can't see a number of you because you have your cameras off. There we go. I can see a few. Kathy, can you give me a thumbs up? I can see your screen. Okay, perfect. Thank you. All right, we will move along then. All right. So, quick question. How many people know who funds the SMP program? Go ahead and just shout it out if you have a quick guess. You don't have to unmute yourself.
Is it the Administration for Community Living?
Ding, ding, ding. Winner,
Okay.
winner, chicken dinner. Thanks, Jean. Yep. So ACL, you'll hear me refer to it as ACL. The Administration for Community Living is who funds the Senior Medicare Patrol Program, and it's through the Older Americans Act. It's funded as part of the Healthcare Fraud and Abuse Control Program. And obviously it is heavily focused on anti-fraud activities. All right, next question. Aside from the 50 United States, what other locations have SMP projects? And again, just unmute and shout it out if you know the answer.
Guam does, my home.
Yes, you're right, Devin. Guam. What else?
Puerto Rico?
Puerto Rico.
Puerto Rico.
Yeah, two more.
U.S. territories.
Yes. So the District of Columbia, so DC, they count, and then the U.S. Virgin Islands. So those four outside of the 50 United States. So when I look at the Senior Medicare Patrol Program mission statement, what I see is a long mission statement, to be honest. So what I've done just to help myself, and I think it's helpful for others, is to break it down into the who, what, and how. So who do we serve? We serve beneficiaries, of course, but we also provide this service and this advocacy to their families and caregivers, right? Because we all know there are people that need their family members to step in and help them, or they have caregivers that help them. And then I think about what's our purpose? Why are we doing this work? Well, our true purpose really is to empower and assist the people that we serve, and we're empowering them to prevent, to detect, and to report fraud, errors, and abuse. The empowerment piece is really important in my mind, because we can do the work for people all day long, every day of the week, but it doesn't give them that sense of security that they might need by knowing how to do something on their own, or to just know how and where to go to get the help that they need. So empowerment, as far as the SMP work goes, is important. And so when we're teaching people, and this will come up later, about preventing fraud in their life and protecting themselves, we want to make sure that people feel the sense that I'm not doing it for them, I'm helping them understand how to do it for themselves as much as they are able. And then how do we do this? The work is very heavily focused on outreach and education, and of course, counseling. Outreach and education focuses on the prevention piece of it, and it does this by educating beneficiaries to read their MSNs, for example, or their bill statements, and then to respond with caution to scam calls or solicitation, and certainly to protect their personal information. Many Medicare beneficiaries don't know how to read insurance statements, and they can be complicated, right? They can take a little bit of teaching to figure out what all of the codes mean, You know, if it says this, what does it mean is really owed? All of that kind of thing. And it can be confusing to look at healthcare bills. You have one total 1 month and then you get a new bill the next month and it's changed, or it reflects certain aspects of services and not others. And they might be completely overwhelmed by the solicitations that bombard them day in and day out. So these are all areas that we help with. To be clear, SMP focuses on preventing, detecting, and reporting fraud, errors, and abuse. Those are the actions that we take. And we do it again in the form of, or in a way that empowers the people we're working with. When fraud does happen, SMP gathers really important information and then reports it to ACL, the Administration for Community Living. They review those reports, and then as appropriate, they will refer them as a case on to the Office of Inspector General. So gathering the right details and enough details is really essential when we're doing this work. And we're going to talk a little bit more about that here in a minute. So let's do a quick review of history here. It's going to be very short. I promise I won't drone on or dig into history and put everybody to sleep. In 1995, the Administration on Aging became a partner in a government-led effort to fight fraud, errors, and abuse in the Medicare and Medicaid programs. And they did this through a program that at the time was called Operation Restore Trust. Some of you may remember it, some may not. I don't know how prevalent it was out in the community, but it led to a partnership, a series of partnerships within the government between the Department of Health and Human Services and Medicare and Medicaid Services and the Office of Inspector General. And this partnership actually continues today. So around this work, all of those agencies have a different role to play in helping to ensure that fraud, errors, and abuse are hopefully minimized. And if they occur or when they occur, they're reported and investigated. But in 1997, the Operation Restore Trust decided that it was a big job and they really needed a way to manage it that provided a close connection at the community level. So they began recruiting and training retired professionals to identify and report errors, fraud, and abuse. And then over the years, Operation Restore Trust kind of morphed into Senior Medicare Patrol. And the focus really since 1997 has shifted from being heavily weighted on investigative activities at the community level to outreach and education, because I think all of the government entities and the program administrators realized that prevention is going to be a big part of how we manage fraud in our lives. The historical perspective really is, I present that to help us understand the mission for SMP as it is, right? The mission is a reminder to the outreach and education piece that all of us can have that conversation with somebody within our network or our sphere of influence. But all of that being said, despite outreach and education efforts, fraud is such an invasive part of our world today. I'm not naive enough to say that just by going out and doing a presentation on fraud, people aren't going to experience it anymore, right? How many of us have received at least one data breach letter in the last 12 months? Maybe 3, maybe 5. Yeah. So every time a data breach letter is sent out, it could be a little, somebody didn't follow protocol and none of the information got out there, but it very well could be that people's information was captured by somebody that it shouldn't be and is then sold to other entities. All of those things happen without our control and without us knowing about it. So it's not realistic to say, if I educate a group of people about protecting themselves and not answering scam calls, they're not going to have fraud. Fraud happens. And so it is reality, and we have to figure out a way to help people when it does happen. So some SMP programs across the country have their SMP program stands alone. It might be in their, sorry, I'm trying to adjust my view here. It's being a little bit wonky. But some SMP programs stand alone, separate from their SHIP program, and some SMP programs, just like ours, exist in partnership with their SHIP or their SHIVA program like we have. To me, having the SHIP and SMP programs together makes sense, right? So, because they sort of complement each other. If I look at the two programs, or within Washington State, if I look at how SHIVA and SMP help beneficiaries or help consumers, I can say that, you know, SHIVA basically is helping people deal with the overwhelming aspect of the Medicare program, right? We help them make sense of it. We help them navigate. SMP likewise helps to alleviate the fear and the stress that people feel when they're engaging with insurance or healthcare or Medicare and not knowing if something is happening to their information or happening to them. SHIVA supports and empowers individuals as they age. Likewise, SMP supports and empowers individuals as they age and as they feel more susceptible to issues around fraud, errors, and abuse. SHIVA is an essential resource for community partners. So for our senior centers, our libraries, our our ADRCs, and all of those different agencies that serve aging Americans, SHIVA is a great resource. And likewise, SMP serves all of those same people in much the same way, again, through empowerment and through helping them feel safer about their information. But we also provide a partnership with local law enforcement, statewide law enforcement agencies federally, that sort of thing. So we have an opportunity to make that connection at a bigger level. The consequences of fraud are really significant, right? We get used to thinking about it because it is such a big part of our life anymore. But fraud is not just a problem of public dollars. It's an issue of creating a vulnerability within people's lives, within our system. And we should be able to figure out a way to help relieve that vulnerability. The cost of Medicare fraud alone has been estimated at anywhere between $60 and $100 billion a year. That's a lot of money. And it's hard to put an exact number on that strictly because it goes underreported. People either don't catch it, they don't report it, they don't know what to do about it. So we have a role to play in how that happens and helping to get those, the bad actors in front of the investigators. Medicare fraud also leaves beneficiaries susceptible to other forms of healthcare fraud or identity theft. It can influence diagnoses, prognoses, and treatments because it can alter what it looks like has been provided as far as treatments or supplies or services or a variety of things. So it's something that we want to be sure that we take seriously. So to be clear, SMP is not a law enforcement or investigative entity. We are really an advocacy program and a liaison between consumers and beneficiaries and the enforcement agencies or our federal partners that can influence how things are managed when it comes to fraud, errors, or abuse. We're a community-based, volunteer-driven advocacy program that helps Medicare beneficiaries, their families, and their caregivers. And to do this work well, we need help from local and national enforcement agencies. These strong partnerships really help our program members stay informed of prevalent schemes and bad actors. And we help them by advising beneficiaries and sharing the information we learn at the community level with investigators and our national agencies. And I'm going to pause for just a moment because I want to make sure if anybody has a question at this point, you have an opportunity to ask. And while I'm pausing, I'm going to fix my slide deck here for a second.
Kim, we keep getting the calls for you will get the free genetic testing, and you can get the free, brace or something.
Mhm. That-
What do we do about that?
Well, we're going to talk more about some steps to take, Runa, here in just a little bit, because there are definitely steps that everybody can take to help with this. And we're going to talk about what the role of volunteers are with respect to the different kinds of cases and that kind of thing. Now, I encourage you to come to the next session, which will be in April. We'll send out an announcement again, and we'll talk more about specific kinds of cases and steps to take with regard to that. For today, we won't dive too deep into all of the different kinds of cases because we get a lot of different things. But just know we will talk a little bit about some steps to take here shortly. Okay. Any other questions before I move on? Nope. Okay. So I did want to give you kind of a snapshot of what the work looks like with regard to Senior Medicare Patrol. So this is a snapshot of the national activity. So all of the programs across the country that are doing this work. Each year, the Office of Inspector General compiles a report based on data that is pulled out of, well, it's pulled out of the SIRS program, which is Senior Medicare Patrol Information and Reporting Systems. But SIRS gets its data when you submit reports through STARS and do a send to SMP. Hold that thought, we're going to talk about it. But needless to say, all of the data that we put in about the interactions we have with people goes to a report that the OIG publishes each year. What you see on the screen are the numbers that the SMP Resource Center has posted based off of those reports. So you can see there's out of the 54 programs, we've got over 5,000 team members. These are active folks who are actively working to benefit people as far as SMP and anti-fraud activities go. There's 18,000 group outreach and education events, and 1 million people reached. They had 246,000 individual interactions. And I want to say these are, I think these were what I pulled off the 2020, well, probably 2023 numbers. And then over 150,000 expected Medicare recoveries. And we'll talk about that here in just a little bit, really briefly. And then savings that have been totaled. So I want you to look at that. And then here is a snapshot.
Not able to see your screen, Kim.
What's that?
Can't see your screen. It's a blank thing.
Is that what everybody else is seeing too?
No, I see the screen.
I can see it.
Okay. Aruna, look and see if you hit something maybe and it went away for you.
Now I can see.
Okay, perfect. Okay, so this is our impact locally, and this is these are the numbers I pulled off of 2024. So currently we have 69 volunteers that send information through STARS that they're doing fraud work or anti-fraud work, not fraud work. About, let's see, 2,700 hours of SMP interactions and outreach. About 14,000 people reached and about 2,000 direct interactions with individuals. Now, I would say, yes, our numbers obviously are smaller than what they're going to be nationally. But I would say it does show that we are having an impact in the lives of our community members, and it's verified through our data. But I also believe that the numbers on the screen don't tell the full story. I think there is more work being done and more conversations being had with people about how to keep themselves safe than what we see on the slide. And that just simply comes down to being able to put information into the system. We will talk more about that. And I will say in the third session of this series, we will be talking almost exclusively about the data entry piece and how to tell the story of the work that you're doing. I do want to be able to tell our SMP partners, our federal partners, about the great work that is being done to protect beneficiaries. And I believe that we have an opportunity to demonstrate greater impact through our local activities that we record in STAR. So that's why I'm designating that third session all about how do we reflect this through our data entry. So let's talk now a little bit about cases. What do the cases look like? What are we typically dealing with? To be clear, healthcare fraud is not a victimless crime. So everybody is affected one way or another, even if you have not yet had a case you've needed to report to an authority. It affects everybody, individuals and businesses alike, because it causes billions of dollars in loss every year. It can raise your health insurance premiums. It can expose people to unnecessary medical procedures and increases in taxes. And because healthcare fraud is not widely reported, it can be really hard to put a precise dollar amount on the overall cost. Despite that, the OIG and the Department of Health and Human Services estimates that Medicare fraud alone is costing taxpayers, as I mentioned a minute ago, anywhere between $60 and $100 billion a year. So it's not something that we can shake off easily, right? One thing to keep in mind is that fraud makes a really good story, right? It's salacious. It's something people pay attention to. It captures headlines. And so it's something that is posted in social media and on news stations. But I will say that more frequently than not, it's billing errors that people are encountering. A beneficiary might be somewhat confused over what their plan benefits are, right? And we all get that way. I have to go back and review my explanation or my plan evidence of coverage to, when I have go see a specialist or do something out of the ordinary to see what that coverage looks like. But a foundational understanding of the SMP program, Medicare basics, and the difference between fraud, errors, and abuse really is what makes up the largest portion of SMP work. So meaning the outreach and the education to the public. Though fraud gets more attention, often the issue is about billing errors. So keep in mind that providing and billing for healthcare services involves a lot of complicated steps. It used to be something you could go and get a job in pretty quickly. Now it's at least a 14-month training process with all kinds of coding training that goes along with that. It has complicated steps, and so it's easy to see where errors might happen. Most Medicare payment errors are simply mistakes. They're not the result of physicians, providers, suppliers, whoever trying to take advantage of the Medicare system or patients. And a billing error is usually corrected without difficulty just by contacting the provider's billing office. Might take a couple of calls, and some billing offices are hard to connect with, but usually it's just a matter of making a phone call and pointing out the error so that it can be fixed. SMP helps with Medicare or healthcare billing errors by teaching beneficiaries how to read their Medicare and health insurance statements, so their MSNs and their EOBs, how to read their billing statements, and how to keep track of their dates of service or the type of service and the service provider. So we do actually have a tool to help people with this, and some of you may have used this. This is our healthcare tracker. And I'm going to see if I can open it. So hold on just a minute. I'm going to see if this will show. So if I make this bigger, can you see the My Healthcare Tracker, the flip it thing there? Yeah. So for those that maybe haven't used this before or seen it, let's take a quick look. It covers.
Well, you can at least read the stuff. You're right. There's a training thing that I was late to, but the audio's not working, and I have no clue why. Because it was coming on making lots of noise earlier yesterday, or when I was doing something at midnight. That's weird.
So if you can see this, the first page, it just talks about what SMP is. I can flip through. It's going to talk about the protect, detect, and report steps. instructions on using this healthcare tracker. And then it gives multiple pages like this where it allows the individual to write the date, who's the provider or supplier or whoever it is that they're visiting, lab, x-ray, whatever it might be, what's being done. They can take notes based on the conversation with their provider, how long they spent with the provider. So you can see there's multiple pages that way. I'm going to flip through kind of quickly on this. And then it talks about the SHIP programs and how they can get help with SHIBA or SHIP. Other important contacts, Elder Care Locator, Federal Trade Commission, that kind of thing, in the end. So let me see if I can switch back. All right, there we go. So you should be able to see the slide deck again. Yes? Okay, perfect. This would be so much easier if we're all just in the same room. So not everybody likes to use the My Healthcare Tracker, but it is a tool in the tool belt, right? It's a way to teach people how to keep track of their medical appointments, of the services that they're getting. Then when they get their Medicare summary notice or their explanation of benefits, or even a bill statement, they can compare it to what they have tracked in their own tracker. If they want to do it in a regular notepad or on the calendar, a calendar they carry with them or in their phone, that's perfectly fine too. But most of us are not very good at remembering at the exact date we saw a doctor, which doctor we saw. Maybe we saw the PA and not the doctor, but the doctor's name's on the EOB. So it just helps to keep track of those things. If there's an error, we can identify it. And if there's fraud, we can identify that as well. Any questions at this point or anything anybody wants to share?
Kim, when I'm talking to people, counseling them for Sheba, I often mention the healthcare tracker. And if I'm sending them materials, I try and send a copy of it with it. And just so that they have a way to capture all those details that can be important down the road. And people have been very appreciative of the copies over the years.
Perfect. Yeah, I love that. Yeah, however it works best. And we have, just so you know, especially for those of you who are volunteer coordinators in the group, we have thousands of these in stock in our printing warehouse. So order them, please order them, or they're going to be in that warehouse for a very long time. But they're just a very useful tool. And again, even if the individual doesn't use it all the time, it helps prompt that thinking for them, right? Check and double check. All right. Sorry, my screen keeps shifting and I'm having a hard time seeing things. Could be a visual problem. All right. So unfortunately, again, like I said, fraud is a very insidious part of our society these days. And it's almost impossible to completely avoid. In fact, if I look at the definition of fraud, it's going to tell me that fraud is something that happens where your information or something is stolen from you or manipulated away from you somehow. But most of the time it happens without the individual knowing until after the fact. So it's not like they're giving permission for their information to be out there. It just gets out there and it's being used illegally. Sometimes, like through the data breaches or in other ways, fraudsters or bad actors get a hold of our personal information and they actually sell it to other fraudsters or organized crime groups. So the information, if somebody, let's use an example. I get a phone call and they say, and a number of you are going to feel this is familiar. Hello, this is Susie. I'm calling from Medicare, and I just want to make sure you have the most up-to-date Medicare benefits. In fact, I want to make sure that you have the right card, because if you don't, you might not be able to get your benefits. So I just need to verify some information with you. Could you tell me your address? I show that you're listed at 123 Lois Lane Road. No, I used to live there. I don't live there now. Oh, okay. So what's your current address? Let me just make sure I've got that correct. Okay, thank you. Okay, now can you tell me your date of birth? Okay, thank you. And then what's your Medicare number, just so I can make sure to get the correct card out to you as we're sending a new card, right? And so you can hear how it goes. And at times, the caller is not just a polite, fake representative of Medicare. Sometimes they're actually very aggressive. If you don't verify your information with me, you aren't going to be covered by Medicare and you will lose your benefits, right? And so sometimes people are unsuspecting and they give out their information. In fact, a perfect situation recently happened where a lady was at the doctor's office waiting to hear about pre-approval for some testing and a procedure that she had scheduled. And she got one of these scam calls exactly like the one I just shared with you. And she thought it was related to the approval for her upcoming services and procedures. And so she did give out her information. And then she realized it was a scam call. So now what the scammer has the opportunity to do is take that personal ID information and sell it to other people or use it to bill Medicare or other insurance for procedures, supplies, various things that the beneficiary doesn't need, doesn't want, didn't order, and Medicare oftentimes will pay for it. So it just will go on and on and on. It's kind of a sure thing for fraudsters. There are other forms of fraud as well. So one type of fraud that we don't hear about as often, but it certainly happens, is called upcoding. Upcoding is a kind of medical billing fraud, and it occurs when a provider sends a bill to Medicare or another payer for a more expensive service than the one that's actually performed. Upcoding can happen in all areas of healthcare. And one example might be when a hospital bills for an inpatient stay at the highest severity level, when really the patient's care was more routine. And often you and I might not catch it unless we're really reading our Medicare statements or our health insurance statements carefully. Excessive medical testing. This can happen, and it can have even more than a financial impact in the person's life, because over testing, which is what happens when a patient receives unnecessary medical tests, can lead to misdiagnoses, false results, or even additional testing. So that can be a very, very harmful thing. A lot of the fraud reported to Senior Medicare Patrol involves items that were billed to Medicare, like I mentioned a minute ago, or other insurances for services or supplies that were not needed, ordered, or received. So a lot of that comes by my desk. We get a lot of calls about that, usually in the form of durable medical equipment. Double billing. It can be an error. So sometimes there's duplicate claims on a Medicare summary notice, but sometimes it's intentional. If it is an error, a simple call to the provider's billing office should straighten out the issue. If it's fraudulent, it might require more investigation and documentation to disprove that the duplicate claims were just an error. And then medical identity theft, which also occurs way more often than I would like to see. And this happens when someone steals a person's personal information, like their social security number, their Medicare number, and they use it to submit fraudulent claims to Medicare or other insurers without the beneficiary's knowledge or consent. Sometimes the fraudster even uses that stolen ID to receive healthcare services, posing as the beneficiary when they go into a provider's office or a hospital or something like that. And I've had a couple of cases where that's happened. Recent examples of cases do include victims who noticed durable medical equipment like knee or back braces or urinary catheters, glucose monitors, billed to their Medicare using their Medicare ID. And oftentimes they don't really know how their ID got out there. So again, it happens without the person knowing. Sometimes the claim being submitted monthly for thousands of dollars each claim or each month, and Medicare is paying them. And the reason, some of you might be thinking, well, why do they keep paying it? Part of the problem is that CMS, or Centers for Medicare and Medicaid Services, by law, have to pay claims within a certain time frame. And I want to say it's within 30 days, but I could be wrong. It could be a little longer than that. But they have a certain time frame they have to make that payment. And so rather than stop their process to investigate the millions of claims that come through their systems, they pay them, and then they hope, if it's fraudulent, that they can deal with it after the fact. Unfortunately, because you're dealing with fraudulent entities or people, your chances of clawing back any money are probably impossible. When someone does notice a fraudulent claim on their Medicare or insurance statements, the steps that we ask them to take will include, and Aruna, this is to your question, we ask people to call Medicare right away and notify them of the fraudulent claims that they've seen. If they have a Medicare Advantage plan or a supplement plan or a Part D plan, and they've seen claims or seen something fraudulent on any of those pieces, they want to call and notify the carrier as well. Then we ask them to contact us if they haven't yet. Even if they have, then we're going to set up another time to do an interview with them. And we'll get some details so that we can then file a fraud report. And again, that goes through the Administration for Community Living, who reviews those reports and then forwards it on to the OIG's office as necessary. Okay, I'm going to stop there. Questions, comments, sharing, concerns?
I had a client 2 years ago who got 8 boxes of braces, different kinds of braces. Worked with Philip on those. We did contact Medicare, but when we went to ship them back to the companies that had sent them, 3 of them were no longer at the addresses that were shipped from. So these guys are really fly-by-nights. They pop up and then they disappear.
Yeah, you're right, Peggy. It's so true. And boy, 8 packages, that's more excessive than I've seen. But you're right. And as soon as they get the inkling that, and investigators onto them, they pack up, they disappear for a short period of time, and they just pop up somewhere else. So yeah, they're I'm just going to say it like it is. They're a little bit like cockroaches. Any other thoughts or stories to tell? Examples?
Yeah, this is Jean, Kim. I find that people are reluctant sometimes to report certain kinds of fraud. For example, when they see what what the doctor charges and what Medicare pays, that's fine. They want their doctor to get as much money as they can. But with the durable medical equipment, they're more likely to report. They don't feel that they're causing their doctor any harm. But I think I reported to you a couple of cases on Whidbey Island where people had been billed, never received thousands of catheters. And so what I'm wondering is, how did that Medicare information reach the fraudsters? Is there a theory about how they get the information to bill for durable medical equipment that's not received?
There's lots of theories, and there's probably lots of avenues, unfortunately. One is, the simple, somebody gets a scam call and they give their information out, right? That's the obvious. The less obvious is that if you think about it, and I have to say, I don't know all of the behind the scenes workings of this type of situation, but pharmacies, doctors' offices, all of these places have that information. They also all have access to programs and systems to be able to pull up your information. So if I go to the doctor today, they can pull up my information. Sometimes I only have to give them my date of birth and my name, and they can do a search to try and find out what my coverage is, right? So there's an awful lot of systems that providers use to access people's information. And as much as I'm sure they are doing the best they can to keep that safe, it isn't fail-safe, right? And so there is the ability of people that have direct access to those systems to be able to get it and send it out fraudulently, right? There are bad actors everywhere, even in doctors' offices, unfortunately. But there are also breakdowns in the system where somebody might be able to get in there and get information. And again, it gets sold here, there, and everywhere. And then every time there's a data breach, realize that your personal information is out there. So it could be your social security number, it could be your date of birth. And oftentimes all they need is one or two pieces to then fit the rest of the pieces of the puzzle together to get all of your information. So it's not, I don't have a perfect answer other than that's the kind of thing that I'm hearing about. Victoria, did you have a question or a comment?
Yeah, I have kind of a question. Can you hear me okay?
Yes,
A couple of months ago, I was notified that a third-party insurance biller, their information was breached. They're somewhere back east, and because of this breach, my social security number and all kinds of other personal information was leaked. And they funded a 1 year of credit monitoring, and so that's where it is now. But I'm wondering, is there something else I should be doing other than just letting the credit monitoring company track any issues?
it feels very incomplete, doesn't it? Just to say, okay, so I'll check my credit. There are more things that you can do. You can go to the credit agency. So there's 3 of those primary credit agencies. And I have to go back and look at the exact steps, but
Yeah,
you
I have a freeze and a fraud alert on all my credit reporting companies. But other than that, it's like what? And when the year is up, I mean, it's not like that information is not going to be out there a year from now.
you should still be able to access the credit reporting agencies. You don't need somebody to give you a free access to that. So you should be able to continue accessing that. I always encourage people to make sure they have a Social Security account set up and a Medicare account. And the reason is, I know I just got done saying, there's ways people get into technology, but good, bad, or otherwise, it's also how we keep track of our information these days. And more government agencies are going that direction, where all of your activity on your accounts is going to be posted electronically. So if you haven't done it, setting up a Social Security account with a secure password, make sure it's a password phrase, not a Kim 123 kind of phrase.
Yeah, right. I have all that stuff. Yeah.
Yeah, and then just make sure you're checking it frequently. Unfortunately, that's the difficult thing, right? Is there's no perfect prevention, because we don't work in the world of fraud day in and day out. And fraudsters, that's their full-time job. And they have access to tools and ways to get into these systems and get our information that we just aren't even aware of. So I think you're doing all of the right things. If you can ask Social Security to put a fraud alert on your Social Security account as well.
Oh, okay.
If people notice or have identified fraudulent claims on their Medicare, I do instruct them to ask the customer service representative to put a fraud alert on their Medicare as well. Some say they do, some say they don't. So I just figure it doesn't hurt to ask.
That's
One
good to
thing
know.
that
That's
Medicare
helpful.
did-
Thank you.
One thing
Mhm.
Medicare did for my client that had received the 8 shipments of braces was they sent her a new Medicare card with a different
Yes.
number.
Yeah, so that's when I tell you that the first thing I tell people to do if they've experienced either fraudulent claims or they've given out their Medicare ID number to a scammer or something like that, I tell them to call 1-800-Medicare and report that their Medicare ID has been compromised. And it's important to say that, and that you want a new Medicare ID number. Now, if you've given out your ID to a scammer, what they will tell you, because they don't like to issue new numbers, what they will tell you is, until we see fraudulent claims, we won't issue a new number. Okay, so that just means you got to watch your account activity very, very frequently. And so if you're on original Medicare and you're getting an MSN every 3 to 4 months, that's not very frequent. A lot of claims can be submitted in that time. So that's why I encourage people to set up a Medicare account so they can go in real time and check it any time of the day, night, 7 days a week. Then if there are fraudulent or suspicious claims or activity on their account, then I suggest to people that they call 1-800-Medicare, report fraud on their account, and then request a new ID number. And what they'll do is they'll move those claims into their fraud unit to be investigated. They won't, you can ask them to disassociate the fraudulent claims from your account. There's not really a good process to do that, even for the private insurers. So there's a good chance they won't be able to do that. But if there's a fraud alert and you've got a new number, hopefully that will help. Thanks, Peggy. That was good. All right, so let's talk, let's see where I'm at here. Sorry about that. So we talked about knee braces, fraudulent claims. Okay. So what do we do, right? So we've kind of been talking about how do we help people then? What can we possibly do to combat this constant and insidious attack on our information? Education is really the key. I know, my mom owned her own medical billing office or practice through her professional life. And she's now 84. She retired enough years ago that her connection to how things work with technology or with accounts or even incidences of fraud are way less than somebody who is actively working in the workforce on a regular basis. And I don't mean that as a criticism. It's just, right? If I'm not doing this kind of work, I'm not going to know about it. So we're the informants when it comes to helping people understand the type of bad actors that are out there, but also the type of activities they're engaging in. The number one thing I see day in and day out are the scam calls. And the number one type of scam call is, hey, would you like a new Medicare card or a Medicare impersonator? So somebody that's calling and saying they are from Medicare. Those calls are happening every day, multiple times a day. And there's two things I tell people. One is, don't answer the phone. Every time you answer your phone, the scammer puts a flag on your number that says it's an active number, which means keep calling until you get the information you want out of the person. So if you keep answering, then you're going to have somebody that keeps calling you over and over and over. So what I suggest to people is notify your friends and family, anybody that you think might be giving you a call, that you're screening your calls, and to leave you a message. Hey, this is Kim. I'm just checking in on you. Give me a call back when you can. If it's a doctor's office you're waiting for a call from, explain to them that you're screening your calls and to call and tell them this is so-and-so from this doctor's office. And then call the number that's posted on their website to make sure you're calling the right number and not just a number that a scammer might leave. Okay. The next thing is to remember that Medicare doesn't call. And so we educate people constantly. I feel like the two things I always tell people is stop answering your phone, and Medicare, Social Security, all of these federal agencies, they're not going to call you. Not that they don't care about you, but you might be one in how many billion, trillion people, right? So they're not calling you unless you set up an appointment for somebody to call. So you would have had to initiate it first. So those are the two really big things when it comes to scammers, but those are really important things. And boy, if yesterday within 15 minutes, I had 4 voicemails from people calling to report scam calls, and 2 of the 4 had given out their Medicare ID just in 15 minutes. So if that's a primary part of the education we're providing to our local community members, that might be 4 less reports that I get and 4 less people whose lives are aggravated by this. And that's something you all can do. There's no special training to just tell people, don't answer your phone, right? So that's number one. Number 2 is know who to call. There's there's three resources I refer to constantly. One, of course, as I've already talked about, is Medicare. So 1-800-Medicare, or if, for people that have a hard time when you tell them dial Medicare, it's 633-4227. So 1-800-633-4227. Tell the customer service person that you got a scam call and gave out your number so that they can put a fraud alert on your account. Call and report that you've noticed fraudulent claims. So who to call, right? On the slide there, you'll see the link for our online fraud submission form, and that's for the Washington State SMP. That goes directly to my desk. And so I prefer the fraud form. I know it's not for everybody and not everybody can access it, and that's fine. Phone calls are fine if the form online doesn't work. But the form online prompts people to give a little bit more detail than what I get in a phone message. And so it just helps to be able to work a case or know which questions to ask when they go through the form submission. And the third resource that I provide to people constantly is the Federal Trade Commission. I've had some conversations with our Washington State FTC partners, and I've asked them, okay, these scam callers, they're spoofing their number, which means that it looks like it's coming from Sheba in Washington State. It's not. It's coming from, Nigeria. It's coming from Florida. It's coming from wherever the caller is coming from, but they can disguise the number. They can even disguise the number to look like Kathy Williams' personal doctor. So they're very, very good at it. And so when I've asked the Federal Trade Commission, why are we reporting these scam calls if we don't even know if the number is real or where the person is calling from? And what they've told me is they do have some tools at their disposal that helps them investigate. And if, let's say that Kathy, Linda, Noreen, and Jill all report scam calls within a couple of days, and they report seeing the same phone number on their caller ID, even if it's spoofed, what they've told me is they have the ability to investigate that. So when people are talking to you about scam calls, have them go to the Federal Trade Commission website. There's a whole page on there about unwanted calls and texts and emails, and how to protect yourself from those, which is not perfect. And then there's also a link in there on reporting fraud. It takes literally 60 seconds to do their fraud report. The do not call list, people will often say to me, I've registered for the do not call list. Well, I don't mean to be rude, but criminal agencies don't care if you're on the do not call list, right? They're not looking at what rules to follow. They don't care. They're going to call you anyway. So having a backup plan, like can you block and delete the number over and over and just not answering, will get you off of that call list faster. Okay, let me stop there for a second. Questions, thoughts, comments, stories? I'm giving Henrietta a headache, I can tell. For those of you that also talk to people, I know Peggy, you do, and Kathy, and a few others, Monica, Mike, maybe, what are some of the things that you are hearing most of the time or dealing with?
For me, it's both the calls and the durable medical equipment.
Mm-hmm.
I actually sent you an email earlier today about 2 more calls.
Oh, okay.
One client received over the weekend.
Okay.
In my experience, Kim, when I'm playing bingo, fraud bingo with a
Mhm.
group of people, I'll get all sorts of reports from the individuals, which I appreciate because it demonstrates the need to be more informed. And you can have head nods all the way around the room, from grandparent scams to hard copies of your Medicare card to, as Peggy was reporting, getting durable medical equipment that they didn't order. So Medicare, I like playing the bingo with a group because it just relaxes everyone and you get a lot of sharing among people.
Yes. Yeah. Agreed. So when we're talking to people, sometimes it can be hard to know, one, what to do, as Aruna brought up earlier, what do we tell people? But also what to ask, like, what do I need to know? And I'm not expecting all of you to be detectives or even SMP counselors. And to be honest, if you were interested or are interested in being an SMP counselor, there is specific training you would need to go through to do that. But that doesn't mean that when you're doing Sheba counseling, somebody doesn't come to you with a problem or a comment or a concern that you might need to deal with in the moment. So let's talk for a minute about a way that you might be able to deal with somebody that comes to you with a concern so that you can then pass that on to myself or to somebody else within your team that does SMP work. So one of the first things I want to say and recognize in this work is that healthcare is very, very personal, right? To all of us. And when other people know about our healthcare situation or even health insurance situation, it can leave us feeling a bit vulnerable. So a lot of times people feel powerless then when they're dealing with insurance issues or medical systems. So then you bring into that mix of emotions and concern and maybe a sense of overwhelm, a scam or fraud or things that are even more, just feel more threatening to them. And oftentimes what that leads to is high emotions. And so at times I get calls or I get messages from people who have encountered fraud or scams, and that's what they're reporting, but they're very, very upset about it. And understandably so. It leaves us feeling so vulnerable. But it does take asking a lot of questions to really get to the heart of what's going on. Because even though somebody says to me, Kim, I'm being frauded or defrauded, that doesn't always mean that's the case. Sometimes it can be an error that's happened. Sometimes it can be confusion over what's covered by Medicare or their other insurance. Sometimes it can just be how the medical systems operate in billing things, and that's more confusing than ever. But we feel that it's fraud because it doesn't make sense to us. So it's really important to ask good questions. So what should we ask? There we go. So one of the things I like to first start with is getting to the heart of what's the concern. So, what leads to you, what leads you to give me a call today? Tell me what happened. And I'll just tell you, usually in this process, there's about 10 minutes where the person is literally unloading everything in their head. And it's not necessarily sequential. So I usually give them about 10 minutes just to share everything that's on their mind about this issue. Then it gives me an opportunity to pause the conversation and ask more pointed questions. So I might ask, so tell me, are you most concerned today because you saw a charge that doesn't make sense to you, or you feel it's too high? Tell me what you're afraid of here. Linda, I see your hand. Hold on just a second. No, that was an accident. Oh, okay. Gotcha. Or is it related to a service? Or is it a claim that wasn't yours? So trying to get to the heart of exactly what it is that happened. Does it have to do with their identity, their Medicare ID, their Social Security ID, their healthcare ID information? Or does it have to do with a bill? Because those are two really, really different things. And so drilling down on that, and then if it is a bill, if it has to do with a charge, are they concerned about the provider, or are they concerned about the way that their insurance covered it or didn't cover it? So you can see where you kind of have to peel the onion, right? You have to kind of keep digging down to what is the issue at hand. And then who else have they reported it to? So again, because this is often an emotional experience for people, if they have quickly jumped to the idea that this is fraud, then they're calling me upset that this is fraud. And they haven't yet called a provider or anybody else, because the first step in their mind is to report it to an authority. And so often I'll have to kind of back up, especially if it's an issue around billing or charges, and say, well, have you talked to your provider's billing office about this? And what have they said? So maybe that's a first step. Maybe have they talked to Medicare yet? That's always going to be a first step. If it's fraud related at all, or a compromised ID, suggest that they give Medicare a call. Have they talked to their insurance carrier about the issue? Sometimes it's a processing problem. Perfect example of, a perfect example that I had recently was a person that had, I think it was 15 charges on their Medicare Advantage EOB that were not theirs. And as we got digging deeper, it turned out that their identity, their records had gotten mixed up with somebody else's. And so we had to go to the carrier and ask that they clean up the records and resubmit. I mean, it took more steps than that, but that's the short of it. So sometimes it is completely different and it's not fraud, even though it looks like it. And then the next really important piece of all of this is their documentation. If it's fraud, then, and I'm going to be putting a detailed report together, I need documentation to substantiate what they're telling me and what we say is happening. If there isn't any documentation, so if I can't see an MSN or an explanation of benefits or a billing statement or a packaging slip for, the braces that just showed up at the door or whatever it is, then it's going to be really hard to submit that report and have anybody investigate it. So the documentation is really important. Okay, I'm going to pause there. Thoughts, questions, concerns? Okay, we'll move on. Okay, so like I said, if it is fraud, so once you've kind of interviewed the individual and you've gotten, their story in writing, then finding out if they can provide you documentation. Obviously, if they can send it in an email, usually an encrypted email is best, then that's great, because then it can be attached to the detailed report. But sometimes that's not possible. And so people will make copies and snail mail them to my OIC office. But I will just tell you, one of the things that I do to make life easy is I use a form that I've developed. The first page or two of the form is literally a copy of the beneficiary contact record print version that we use from STARS. So that enables me to capture all of the information I'm going to need to create a record in STARS. And it's on the front. I have to go looking for it. And then I have a couple of pages that include more detailed questions. And I'm going to see if I can switch and show you. Okay, so you should see a form. You see the form on the page on the screen there? Yes. Okay, so you can see that the front page there is just the beneficiary contact record, right? They've changed a couple of things. Oh, no. Sorry, the dog's barking. But basically, it's all of the information I might need in submitting my report via STARS. If I go down, scrolling past, and this is our demographic information that you would collect. And then I've got a few pages where I can document the story that they're telling me. So can you describe what happened? When did the event occur? What type of fraud is it? Right? And so this is kind of my case interview notes section. And so it goes about 3 pages. So let's see if I can switch back to. All right. So that's a format I use. For all of you, if you haven't been trained to be an SMP counselor, you don't need to go that deep. You would need to gather enough information to determine what the essential problem is. Is it a billing problem? Is it truly fraud? Do they have documentation? And then you can forward that either to myself to then pick the rest of the process up from there, or to someone in your team who is an SMP trained counselor to then work the case and do the report. But that being, and then the next piece of it, of course, is to report to Medicare, like we've talked about, and to report the case to me, either sending it to my email or through that fraud form, which is really my preference. And then the final piece for all of you, if you're having this conversation with a beneficiary or a family member or a caregiver, is to record it in stars. And we will go into this more in the third session in depth. This is a beneficiary, just a picture of the beneficiary contact record in stars. If you are having conversations with anybody, whether it be educational, informative, or about a fraud complaint, any aspect of protection, detection, or reporting fraud, then I want you to report it in stars. And it's as simple as filling out your contact record like you normally would, and clicking yes, where it says send to SMP. And then further down, you're going to select a fraud topic. So it might be Medicare card. It might be fraud and abuse under the Part A and B section. Okay. All right, I see that I'm getting long on my time, and I apologize for that. I'm yakking too much. So I'm going to go quickly into the role that volunteers play, because I've talked about a lot of different steps to take, but I want to kind of put it in the framework of the role that the volunteers with SMP play. So there's a couple of things that happen, right? We have fraud counselors and fraud outreach, but we also have other aspects. So there are some people that don't want to do like presentations or events like that. They don't want to do the counseling, but they're happy to go to health fairs and provide information, say at a booth. Perfect. You might be doing that with your Sheba work already. That should be logged in stars. And guess what? You are doing SMP work by doing that. You might be doing data entry. So maybe you have some team members that are not as great at doing the data entry, and your volunteer coordinator would love to have some help entering things in stars. That's a volunteer role. That's perfect. Distributing information and so on. Counseling, in addition to outreach and education, is kind of the top role. SMP counselors perform interactions like informing a beneficiary to call Medicare when they give out their ID, talking to them about case details like I just said, and then coordinating with me, educating them on how to read their MSNs. That is such an important task. So SMP counselors are really, really helpful. Typically it happens in one-on-one counseling, just like your Sheba work does, but sometimes it happens in small groups as well. Community outreach. This is the next really big thing. Actually, this is probably the top role that I would love to have a lot of volunteers doing. This can be anything from, like I said, hosting a table at an event. It can be doing presentations to small groups or large groups. It can be going around to senior centers and talking to their membership about protecting themselves. It can be a whole lot of things. Going to the libraries, working with your Sheba team to kind of coordinate these tasks and efforts and activities. A lot of times people will be hesitant when I say we would love to have some presenters. Here's what I'll say about being an SMP presenter. The information is really, really straightforward and easy to present. It's not super complicated. The other part of it is that the training to be a presenter involves lots of time to practice, key talking points. So all of the things are provided for you and happen within a team setting. So I would say if it's something you're nervous about, I encourage you to look into it anyway, because I'm really big on supporting people who like to present or who would like to learn more about presenting. So SMP specialization or volunteer specialists does require SMP specific training. So if you do want to be an outreach specialist or a counselor, you know, reach out to your volunteer coordinator, your RTC, reach out to me. It does require some training. Once a volunteer has completed the Sheba basic training, so if you have a new volunteer and mentoring, then they let their RTC or their volunteer coordinator know that they're interested in being an SMP specialist and doing that work. And then you'll get connected with me and we'll talk about next steps as far as that goes. It can be in addition to the Sheba work that you're already doing, or it can be separate. Really, there's no specific parameters around that. Realize that all Sheba volunteers can provide information about SMP and about protecting yourself from fraud. And all can educate Sheba clients on how to keep their information safe. So there's no specific training that is needed for just having the conversation with folks. So before we wrap up, and we're about at the end here, I just want to share a couple of quick things, kind of bring it back to the beginning of our conversation, where we talked about how the Administration for Community Living provides this opportunity for us to educate our communities about fraud, errors, and abuse, and how to protect themselves, et cetera. So if I were to look at sort of what's the flow, how does this work, and why does it matter? I would look at it this way. ACL, or the Administration for Community Living, provides the funding to the state, right, to prevent, detect, and report fraud through volunteer-driven activity. Then Sheba and SMP at the state level work with community-based programs like the programs you all are part of and agencies to assist volunteers in performing these activities related to the goals of Sheba and SMP. And then Sheba and SMP report back to our federal partners how things are going. That's kind of the circle of life, so to speak, of how these programs operate. And that's how we tell the story to our federal folks and advocate for their support and their ongoing funding. In our SMP agreement with our funders, we have said we will participate and and implement these activities and more. And you can see that just like our Sheba work, we will continue to strive to train and deploy volunteers to do much of the SMP work with a very strong focus on prevention through education and outreach. And the goal is for consumers to be educated through about protecting themselves and their benefits from fraud and scams. Likewise, community partners who are doing Sheba work also receive SMP funding as part of their sponsor contracts. So all of the sponsors that you're all part of, the SMP funding is part of that. So the activities are intertwined and we all work together to try and meet these areas of focus. These are, just so you can get a quick picture of it, these are the 12 performance measures that we report to our federal partners about. For our Washington State SMP, we focus on the first 5. Some are able to focus on all 12. We do not have the mechanisms in place yet to report out on cost avoidance and monies recovered and that sort of thing. It takes some extra steps that we just haven't put into place yet. So that will be coming down the line. But just so you know, performance measures 1 through 5 are what we have to report out on a regular basis. And so when I send you an email reminding about data entry, or I ask a question about hours worked or how many people were reached, that's what it's all related to, just so you can kind of get that bigger picture. All right, we're at the end. I've talked a lot. Based on what you've learned today, tell me, you know, what are your thoughts? What are some of the activities that you're engaging in? Just real quick, let's do a check-in. You know, what are some things that come to mind for all of you? And I'm going to go to this next slide real quick so you have that information. Everybody's thinking about lunch. It's getting to lunchtime.
Just a comment that I'm seeing more calls from people because they read their explanation of benefits from Noridian that they hadn't done in the past. just
Mhm.
because they've been inundated over different mediums concerning the fraud and looking for fraud. And
Mhm.
so I'm just, there's a benefit for us doing this because people monitor
Right,
their stuff better.
right.
Hmm.
Yeah, thanks, Dave.
And Kim, here in Island County, we have a display of materials set out. We always have those trackers out. And then when we do our presentation for volunteers, we always include Medicare fraud.
Awesome. Very good. Well, wonderful. I appreciate all of you being here, and I encourage you, if something occurs to you following any of these sessions that you have a question about, my email's there on the screen. Shoot me an email. I'm very quick to respond most of the time, unless I'm out of office. And so I'm always looking to engage in more conversations about how we can make this something people see and hear about at the community level, how I can support the work you're doing, whatever it might be. I will be doing a public presentation on March 26th, I think it is. I'll be sending something out. We'll be posting it on social media and on our website. So you'll be able to let all of your community members know. It'll be at 5:30 in the evening to accommodate, people's work schedules and other things. And I will be co-presenting with Danae Jobert from the Better Business Bureau, who will be sharing some of the fraud trends she's seeing in the work that she does. So I encourage you to join us for that and invite friends, family, and community. All right. Any other questions before we go today? Charlie, can you explain? Charlie, you said if there's a file that we can send for comments. Tell me more what you're thinking there.
You showed it on the screen, the detailed thing you fill
Oh,
out when you're
yeah.
speaking. If that's a file, that would be great. That's all.
Yep, the case interview form.
Yeah, yeah.
Okay.
Unless you've already sent it to me and I forgot, which is quite likely.
No, it's one I've been revamping. What I will say is I will share that with you, Charlie. Yes, I will send it out.
I
And
mean,
my ask,
whenever you're ready with it, I'm fine with
Yep.
it. That's fine. Okay.
Yep,
Thanks.
and my ask is for people who have not gone through the SMP training. If you're using it to gather data or details, please make sure that you fill it out and send that back to me so that I can build a report off of it. In other words, I will be submitting the more detailed reports through the SIRS database, which is not a database that you folks have access to. And that's the database where the report goes to the OIG's office. So if you're using, a form or you're collecting details around a case, send those to me and then we'll kind of go from there. I'll talk more about this at the next session in April too. All right.
So Kim, you mentioned, I think you said the 26th that you're doing that presentation in the evening.
Mhm.
Are you posting that somewhere? Is that like on Trumba?
It will be. We will be
Okay.
posting it. In fact, I got to get back with Donna Wells and get that posted. It took us a little bit to get it established just because we had some issues with Zoom accounts. But now that we've got it worked out, we'll be getting that sent out.
Okay, perfect. Thanks.
And I'll stop the recording.